essential hypertension, which has no cause. And many a times when people come to the hospital and you want to make a diagnosis of hypertension, people want you to look for the cause of hypertension. But in the case of essential hypertension, there isn't any cause. It's mostly because it's genetic, mostly because it's familial. And these ones are managed just on their medications, apart from the lifestyle modification and other things. But the non-essential, which usually has a cause, we manage the BP, and then we try managing what the cause is. So those ones are the ones that would resolve if the cause is being dealt with. And in the case of those ones, that is when we talk about kidney diseases, the heart diseases, the thyroid, and then some artery diseases, other organs to adrenal glands and all of that. We also have hypertension that only deals with pregnant women. Someone would say it's not fair. The women are carrying our babies, going through that stress, and they still will have to develop BP if high blood pressure, if they are genetically exposed. So I'd like to talk about the disease burden. Why are we even talking about hypertension? Why not malaria? Why not typhoid? It's just because globally, as at the end of the year 2024, about 30 to 33% of the total populace are hypertensive. Then in Ghana, we have about 35%. So those of us here, if we take 35%, we would have hypertensives. If you are true to yourself, some people are already on medications here. I'm not playing the devil's advocate, but it is the truth. 35% of people are diagnosed of hypertensive, but unfortunately, only half of these people are aware that they have the condition. Most people are walking about without even knowing that they are hypertensives, and that is the reason why we advise that we all do our annual screening where we can pick these things up. Even with this half who are aware that they are hypertensive, it's just 20% who get good control. There are people who are taking their medications religiously, but for some reason, they still don't get good control. In that, sometimes they get BPs fluctuating. At one point, it's normal. The next moment, it's high. And these people will need to see the specialist. They will need to come to the hospital. They either see the GP. If there is a need to be referred to see the physician specialist, we do this for them. Because when the BPs are up, even though you are on medication, what it means is the damage keeps going on. So at the end, we end up developing the complications of hypertension, which we are trying to avoid. So, risk factors. What puts you at risk? We talk about obesity. And to do this calculation or to know about obesity, we need to calculate with your height and your weight. And I'm sure most of us here are obese. If we would have to do that calculation, it's not just about being fat, but sometimes you may look normal in quotes, but if we do the calculation, most of us, including we the health workers, will fall into that category. So if you really want to know about it, medical screenings like this or medical screenings you do at the health facility will put you will give you an idea of where you fall. Then people who drink alcohol. These days we take a lot of things, the men especially. My fellow men, I have a lot of men here, and I know that people are drinking things to do things. If I say this, I know you people understand what I mean. People are mixing concoctions, adding them to alcohol, just to be able to use them for certain functions. The alcohol on its own, alone, would put you at risk of developing high blood pressure. Now that you are even adding other things, you don't know the components of the other things. And the other things would force your heart to push a lot of blood around, And what that means is that your BP directly would be elevated. And because sometimes it is silent, you don't know that you are going through a lot of pressure until the complications set in. Smoking. Most people smoke, and especially people who do nicotine, the cigarette. Most people do this, and this also puts you at risk of developing high blood pressures, which is a long-term complication of smoking. So if you are the type who smokes, I think people smoke for different reasons, but if you think you need help, people are addicted to smoking. People smoke because they want to be energized. People smoke to sleep well. So if you think you have any problems, if you think you have any of these reasons why you smoke, there is always an alternative. You can always come to the hospital. You talk to your doctor. If it is Raphal that you come to Raphal. Raphal will talk to you. We will take our time to explain things to you, give you an alternative. If you have any other facility or any other doctor you visit, you need to make time to see that doctor, and this doctor will help you. Physical inactivity. Most of the time when we come to the office, we are glued to our seats because we have a lot on our desk to clear. This doesn't exclude even we the health workers. Usually you come to the hospital, you see us seated morning to 3, you close, you are tired, you want to sit. You get home, you lie down, you end up going through the day without having any activity. But it is advisable that at least twice in a week you do some strenuous exercise just to put your heart at work, just to make you sweat, just to make you burn some calories. Because physical inactivity in the long run will end up making you develop hypertension. And once you develop hypertension, what it means is that you will have to take medication for the rest of your life. So to prevent taking medications for the rest of your life, you would rather exercise, you would rather lead a good life, so that you won't get to that point where your doctor will now tell you that Mr. So-so and so or Madam so-so and so, you would have to be on medication for life. Poor dieting. There are people who take caffeine, people who take lots of salt, certain ingredients that we add to our food, in the long run end up increasing our BPs. Some medications, sometimes you come to the hospital, we put people on certain medications, they go home because they got relief. If they have the symptom again, instead of coming back to the hospital, they don't. They just stay home and buy the medications themselves. Some of these medications we give to you, you are meant to take it for a short period. After a certain time, you are not supposed to continue with it. So there was this time where we saw these patients who in the past had a problem with his joint. Then he was diagnosed of arthritis. Usually in arthritis, we manage with steroids, but we manage with short-term intake of steroids, and even with that, we taper down. So let's say you are taking 30 milligram, you start with 30 milligram, you drop to 20 milligram, then you drop to 10 milligram. You don't stop abruptly. But because he took the steroid for that short period, he felt better. He started buying it on his own. It's actually a medication you can just walk to the pharmacy and buy. So he was taking it for years without consulting any doctor. Several years along the line, he fell ill. Then he came to the hospital. Then that was when we met him. Then we realized his adrenal glands were not functioning. We did all the investigations we could do. We couldn't really get why. Then we started talking to him. Then he drew our attention that he's actually been on prednisolone for a very long time. And by then his BPs were up to. Now we had to manage the BP, and we had to deal with the new problem he's created for himself. So usually some medications can cause hypertension. And if you want to take any medication, it's ideal that you see your health caregiver so that he can advise you appropriately. And we'll talk about some symptoms of hypertension. How do I know that I'm hypertensive? What are the signs? What should draw my attention? Generally, hypertension can be asymptomatic, and that is why we call hypertension a silent killer. Most of us will be walking about without even knowing that we have the disease, because it would give you no signs, and before you realize, it takes you out, as in it will give you complications or it kills you. So people who are lucky, I would say they are lucky because at least they get symptoms. They get something to motivate them, something to push them to come to the hospital. They are the people who develop headaches, palpitation, dizziness, blurry vision. Depending on how high the BP is, they feel nauseous. So not all nausea is as a result of if not taking a dewormer. So when you start feeling nauseous, you need to check your BP just to be sure. If you're not getting any cause of the nausea, you would have to come to the hospital. Let us help you decide that, okay, this is because you have not taken a dewormer. It shouldn't just be try your luck. Peripheral numbness. When your BP is up, it can make you a bit numb. So not all the numbness is normal anansi, as we call it in our local dialect. And you would have to check. When you come to the hospital, if you are hypertensive, or if we diagnose you hypertensive, we check all the organs, from kidney, liver, the cholesterol level. We do all of this just to be sure that, okay, you don't have any damage, and we protect you from there. Okay, so being hypertensive to some people, it makes them tired. So it's not always the case where your blood level is low that you feel tired. Or it's not just about the stress. Some people always feel tired and then they attribute it to stress. Oh, my boss is stressing me. This work is stressing me. It's not always the case. You need to come to the hospital, or you need, at least, if you can't get to the hospital immediately, most pharmacies around can check your BP. I'm sure we have an infirmary here. If we do, you can just walk in there for them to check your BP, and then you are sure. All right, so the final part is the management of BP. Hypertension is a condition that you would always need a health caregiver to help you manage it. So it's not just about medications. It comes in with other lifestyle modification. We talk about exercise, we avoid late eating, reduce salty food intake, you avoid alcohol, all the things I mentioned, smoking, too much salt, we reduce it, caffeine, we avoid caffeine, and then we exercise. I think I mentioned exercise already. So if you get to the hospital, apart from doing all these investigations, we don't act, one doctor will not act as a hero. He sees you. If there's a need to see a dietitian, he makes the dietitian see you. If there's a need to see the physician specialist, he makes him see you. If there's a need for you to see a cardiologist, you would have to see a cardiologist. So once a year, if you are hypertensive, it's ideal that you go through all these people. Let them also assess you, because one person don't know it all. Let them also assess you to see if there isn't any other thing going on. Because hypertension, at the end, if we don't treat it well, if you don't come to the hospital for us to manage you, and if you come to the hospital or we don't treat you well, in the sense that, if I talk about we not treating you well, it means you're on medications, but you're not getting results, and we are not making any specialist see you, and we keep giving you the same thing. That means we are not treating you well. If we don't do these things, there are complications such as stroke. Since hypertension is as a result of pressures in our blood vessel, the smaller vessels, the tiny ones, are unable to withstand this pressure, and at the end, we end up getting these vessels rupture. If it ruptures in the brain, this person will develop stroke. And we all know that managing stroke is more expensive than managing the hypertension on its own. Because of this same pressure in smaller vessels, it ends up destroying kidneys. And that is why these days we get a lot of people with chronic kidney conditions. I'm sure most of you have heard the news, how much it costs to take care of one dialysis session, not even one patient, but one session. I think even in the government sector, they are taking a little above 600, and you need like 2 sessions or 3 in a week. So even if it is 2 per week, that's like 1,300. Let's multiply that by 4. That is what you are spending in a month. But if you come to the hospital and we manage you, you will not even spend up to even 10% of that value. Yes, hypertension can also cause blindness. It's not all blurry visions that are as a result of familial eye conditions. Sometimes it's because you're having high blood pressure. So if you have issues with blurry vision, double vision, some dizzy spells, I think you need to come to the hospital so we see you. Then, if we don't manage your hypertension well, you can get a heart attack. We all know how our health system is in Ghana. And managing heart attacks sometimes is a bit difficult. You end up losing the people. Maybe elsewhere they may do better, but in all of this, if you want to avoid all of this, it's better you come to the hospital so we manage your BP well so it won't lead you to getting a heart attack. Apart from heart attack, we can also get heart failure. We talk about heart failure, we mean your heart becomes very weak. We all agree that the heart is like the engine of the body. I don't know I'm sure most people drive here. I don't know whose car moves without an engine. If your car can move without an engine, then maybe I should contact you so that you link me to the supplier. And the heart is the engine of the body. If hypertension lingers on for a long time in the body without good control, the heart becomes weak. And when the heart becomes weak, you get more hospitalization. You have to spend more. It reduces your activity. Things that you're able to do before, you'll be unable to do them. High blood pressures can also lead to dementia, forgetfulness. We need our brains to think, to reason. But if the pressures are high, there's a lot of stress on the brain, and which will lead to forgetfulness. And then the final one is for the men. Sometimes hypertension can even lead to erectile dysfunction. So you ask, how does hypertension lead to erectile dysfunction? To get an erection, you need peace of mind. It comes from the brain. If you are worried, if you are broke, if you have an issue going on, sometimes you don't get an erection. And I know the men will testify here. So if you're having pressures going on through your brain because of high blood pressure, then it means that Kwekudon's will not get up to perform its function. Thank you. All right, so now I know a few people may have 1 or 2 questions that if you want to clarify, you could ask me here briefly so that we can go and then start the medical screening. Like I said, I'm not giving a whole lecture, it's just a talk. So I've said what I have to say.
Drugs have side effects, so people don't want to go this way, they prefer to go about because of the side effects.
Of the BP drugs?
Like BP drugs and other drugs. Okay.
Generally.
How do you manage the side effects that comes with this drug?
Okay, so he wants to know how we manage side effects of these medications. If you take the leaflets of every medication, you see a tall list of side effects. So the pharmaceutical companies put these there as disclaimer. If the fact that there is a side effect written on it doesn't really mean that you would experience it once you start taking the medication. So you take most of the medications and you see headaches, you see nausea, the urge to vomit, you see numbness, you see dizziness. Mr. A can take it and have any of those side effects, and Mr. B would take it and not have any of those side effects. However, if we start you on the medication and you have side effects, you report to your caregiver, and we will. There are 1,001 medications or alternatives. So once we start you on, and for some reason you are experiencing these side effects, you just notify us, and then we take you off. So for instance, in the case of hypertension, some of the medications can rather cause erectile issues. So if we put you on and you come to tell me, doc, the medication you put me on is giving me erectile dysfunction, we take you off the medication, then we give you medications to revitalize you in a short period, then you are back to your normal. If we give you the medication and it's making you vomit, you come to the hospital, we change it, we give you medication to counter that side effect of vomiting. I don't know if I've answered your question. All right, thank you. Please, any other person?
Good morning. This we heard somebody saying it, that somebody who have a high blood pressure, when they request the blood at the hospital and he donated it. So he donated same to the patient. How true is this?
Come again.
The person donate blood.
Okay.
Okay, but he's having the
High blood pressure.
high blood pressure. So how true is this one?
No, I don't
How
get
it donated it, and then the other man also is affected. The victim is affected.
Okay.
Yes.
Okay. All right. So he's saying that if you are being transfused with blood from someone with high blood pressures, you end up developing high blood pressure. This is not true. It doesn't happen that because they've transfused you with blood from someone with high blood pressure, you would end up developing high blood pressure. In any case, if you have high blood pressures, we don't take blood from you, and that is not because you are going to transmit your high blood pressure to another person. All right, thank you. All right, thank you very much for giving me a listening ear. I think this would help us all go a long way with doing annual medical screening just to take care of ourselves. Thank you.